Dr. Mekella Mehmet Yesil from Community Health Screen. Today on my show I have the lovely Sibel Ihsan. She's a clinical practitioner for London, and she's come to give us some advice about obesity today. Welcome on the show, Sibel.
Thanks for having me,
Mekella.
Yeah. So my name is Sibel. I'm a pharmacist. I'm a lead pharmacist for Waltham Forest, and I currently work at North East London Foundation Trust.
It's very good. Nice to have you here anyway, Sibel.
Thank you for having me.
That's all right. Just going to talk a little bit, not too much, but about obesity. So we're struggling with a nation of obese people at the moment, and just want to clarify, what is obesity? Why are we getting so fat?
Yeah, so I mean, there's a lot of factors that can contribute to somebody becoming obese. So what I'll do is I'll just talk through some of the factors which can contribute, and then strategies that we can sort of enforce as patients in the population to help tackle obesity. So I guess one of the key things is living a healthy lifestyle. So a lot of patients that are obese, they tend to not have a very healthy lifestyle, and by that I mean they don't really sort of look at sort of like the things that they eat. So it's really important that for us, as you know, as a general population, we ensure that we have a healthy lifestyle and we try and live as healthy as possible. So that includes making diet changes. So obviously some people that have obesity, they tend to sort of eat foods that are very high in calories, and they tend to go down the sort of the more processed foods.
Like McDonald's or Kentucky, for example?
Yeah, exactly, yes.
Burger King?
Yeah, so all those things they're very high in saturated fats. Diets that have less fibre, not drinking enough water, that can definitely sort of contribute to having obesity. One of the other things is genetics, so that also plays quite a big part, and it really sort of depends on our predisposition in terms of our genetic makeup. So that can also be a contributing factor as well.
That's quite interesting to know.
Yeah.
You know what I was going to ask you? Does somebody who has, for example, has a curry on a Friday night count as somebody who's being obese, as to somebody who can have 5 McDonald's in the week and be a skinny rake, for example? I mean, are we talking about genetics there, or are we just talking about balance?
Yeah, I mean, to be honest, it all sort of depends on what are so a lot of medical conditions, like things that you've just alluded to, can also contribute. So, for example, polycystic ovary syndrome, that tends to put somebody at a higher risk of having obesity as well.
Okay, that's interesting.
And
what about thyroid?
And thyroidism as well. So more specifically hypothyroidism, where you have low metabolism. So that can also contribute.
What is the word metabolism? We use it quite often in medicine. What is it? Does it mean that somebody can run faster than me because they're younger and fitter, or because I'm a lot older than them, I run a lot slower? Is that what metabolism means then?
Yeah, so I mean, when we refer to somebody as having a high metabolism, it just tends to mean that obviously they're able to sort of break down that sort of like energy exactly a lot quicker than somebody that would have a low metabolism, in which case it may take them a lot longer.
I understand. Yeah. So
there are other conditions as well, like hormonal imbalances.
Someone in the menopause, for example.
Exactly. Yes.
So there's a lot of stigma around women in their 50s now saying that they've got a lot of visceral fats.
Visceral fats.
So what is the contributor to that, would you say? Is that diet and lifestyle, or is that just aging?
Yeah, again, it could be all three, to be honest. Obviously, the older we get, sometimes we become more sedentary, so obviously we're not getting enough exercise. Sometimes, obviously, we might be housebound, in which case we're sort of confined to our our house. We're not really moving around a lot, we're not very active. So those can all be sort of contributing factors.
So again, like during the pandemic, a lot of us didn't go out, did we? We were all housebound.
Exactly.
We were just eating all day. I mean, I saw loads of TikTok videos of people making bread and cooking and eating all the time, but obviously the gyms were closed and everything else. And I think that again is a high factor, because not everyone can afford to go to a high-class gym and pay hundreds of pounds every week.
Yeah, especially now, because times have become a lot harder.
That's right.
A lot of people are obviously struggling financially, so it just makes it a lot more sort of important to be able to sort of put measures in place within our lifestyle and our day-to-day activities to ensure that we do get some level of exercise, even if it's just walking 30 minutes a day, as the sort of like the recommended amount. Yeah,
that's really good. That's a lot of good information there coming out from this discussion. Thank you for that, Sibel. There's a bit of a hype now with certain things and medications out there. I've heard of, is it Olistat, Ali, Ozempic? What are these? I know you're a clinician, so you obviously know a little bit more about these from a pharmaceutical point of view. Yeah. What's your views on them? Do they work?
Yeah. So, I mean, Olistat. So, Olistat is the generic. So that's a brand name. Sorry.
Olistat.
Yeah.
Okay.
Zenical is the generic name, and you can actually buy this medication as well from chemists.
So you can go to the counter and ask for it.
Yeah. So it's actually available over the counter
without a doctor signing anything.
So you always have to have like a consultation with the pharmacist.
Okay.
But it is something that is available over the counter if, following assessment, somebody is suitable for it.
Okay.
So what it does, essentially, Orlistat, so it has been approved by the FDA, which is the Food and Drug Administration, and it reduces the amount of fat that the body absorbs. So essentially, it basically reduces the amount of calories, and that basically results in lowering weight.
Okay.
So it has been around for quite some time. So it works by blocking the absorption of dietary fats in the intestine, and then it can lead to weight loss over time.
Does this mean more trips to the toilet, perhaps? Does it?
So it can cause, there are some side effects, so it can cause flatulence, it can cause, sort of like oily stools, abdominal cramps.
Okay.
So the sort of the things that you'd sort of see with like gastrointestinal sort of symptoms.
Yeah, I understand. And you said they've been approved by the FDA?
It has been, yeah. So there's been some clinical trials, interestingly, which have showed that it's actually really effective at promoting weight loss. And there was a trial that looked at people that were actually on this medication versus those that were given the placebo.
Okay.
And those that were given the medication, they actually saw that they actually lost 5.3 kilos within the span of 6 months, as opposed to 2.3 kilos for those that were on the placebo drug.
So the ones that were placebo still lost weight, but just did it mindfully, not realising. That's interesting.
Exactly.
And what about?
I was just gonna mention what it is really important though is before obviously this medication is started, it's really important that you consult with your GP or a nurse to ensure that you have like a clinical assessment before the recommendation is made.
100%. Yeah.
So what they would normally do is in a clinic setting, a patient would go and visit their GP. They'd get their weight checked, they'd get their height checked, and then a calculation of their body mass index would be made. And then according to that, that would obviously set the criteria for actually making the recommendation for the medication. And obviously it would be a sort of a holistic approach. So you'd set like personal goals with the patient. You'd ensure that they're sort of realistic, something that the patient can achieve over time. And obviously then there'd be review periods where you would start taking the medication, and then at 3 months, 6 months, 12 months, you'd then go and have an annual review with your GP and see if it's actually made a difference.
Is there any particular person that this might not be good for example, like obviously we want to rule out pregnant women or stuff like that, but someone who's on other medication, for example?
So it's actually quite a good drug in that sense because it doesn't actually have many interactions with other medications.
But
obviously it's really important that if you did want to start this medication, like I mentioned, you do consult your GP because they would obviously have more knowledge around your sort of like your medical conditions, any comorbidities, any sort of other medications that you're on, and would be able to sort of judge whether it's something suitable for you to take.
That's really interesting. Some really good sound advice coming out here. Also, I was going to ask you, Sibel, the Ozempic pen or something, it was for people with type 2 diabetes.
Yes.
It's been proven that a lot of famous people in America are using it now. Is that true?
Yeah, so it's called Ozempic, yeah, and it's actually, the generic name is semaglutide. Yeah, so this is actually a medication that is used for type 2 diabetes. So its first licensing was for type 2. It's been around for a very long time, and it's again approved by the FDA, so the Food and Drug Administration, and it's found to aid weight loss in patients that without diabetes. So it's a GLP-1 receptor agonist, which works by increasing insulin secretion and reducing glucagon secretion.
That's right.
Yeah, so it can lead to lower blood sugar levels and obviously then decrease appetite, which is the purpose why it would be used for weight loss.
Ideally, you would eat less food when you have the injection. Is that correct? Would it suppress your appetite?
It would suppress,
yes,
it would suppress your appetite essentially, yeah. And clinical trials actually showed that it's actually reduced body weight by about 15%. So it's got some quite promising data.
That's interesting. Okay, well, thank you very much for that, Sibel. Our next one, well, let's have a look. It's gastric bypass or surgery. Now, a lot of my friends that I work with and stuff like that, a lot of them are sort of resorting to having gastric bypasses or going to Turkey to have surgery. What's your views on that long term?
So obviously there is a set criteria which you have to meet in order to meet that eligibility for bypass or surgery. But it's typically for patients that are have a BMI of above 40.
Above 40?
Or 40, yes.
That's quite
unless
high.
It is high. It can be lower, but that's if patients have severe illnesses, like for example diabetes, or if they have like sleep apnea, which is basically stopping breathing, finding it very difficult to breathe during the night. So those are the sorts of like the sort of the criteria for actually making the recommendation for gastric bypass. It does so the gastric bypass it does involve creating like a small stomach pouch and rerouting the small intestine to this new pouch, which basically restricts the amount of food that can be eaten, and then obviously it reduces the absorption of calories and nutrients.
Yeah, I always find when people ask me this, again, a lot of people that they don't know this, but like before they have the surgery or before they go and undergo anything like this, they need to have counselling, because the impact would be quite severe, because after the surgery, they come out of hospital on just shakes or just like broth or stock or whatever, and then they have to have top-ups of vitamin B12 injections because they're not getting the vitamins from the natural sources of food. What do you suggest with things like this?
So I mean, obviously it's bariatric surgery. It's quite it is a big surgery to have, and there can be complications, which is really important that obviously those that do get recommended for this type of surgery, they have a thorough consultation beforehand. But yeah, so I mean, it can obviously like lead to certain like complications like infections, which is very common,
as well,
and deficiencies like you mentioned, vitamin B12, because obviously it's something that is affecting our sort of our abdomen area, exactly.
Correct,
so it can obviously affect our absorption of certain vitamins and certain foods. Exactly, so there may be requirements for supplementation.
And obviously, again, like people who want to have this sort of surgery, they need to get proper counselling before they have it, because a lot of the time it's a mental thing and not just a physical thing. And obviously age plays a part as well.
And essentially it's trauma to the body, isn't it?
It is trauma to the body, absolutely. Coming on to the last few minutes of the show, what do you think as a clinician would you recommend to people, to sort of like people who are worried about the size and the behaviours of their food? What strategies would you implement to them? How would you move forward? In terms of diet and lifestyle.
Oh, okay. So I mean, like I mentioned at the beginning, so obviously trying to ensure that you live a healthy lifestyle. That means sort of ensuring that you get some regular exercise, whether it's walking, swimming, jogging, even sort of like going to the gym, strength training, that's really good. Any form of exercise is really good, to be honest. Ensuring that you have a healthy diet. So we
talk about diet. Just explain to us what should be on our plate, for example, for someone who's obese wants to lose weight. Yeah,
to be honest, a little bit of everything is good. We tend to not advise patients to sort of ban foods as such, because it's important, because sometimes when you sort of think that you can't have something, it makes you tend to crave it a little bit more. Exactly, so we say everything in moderation, but obviously we emphasize on like fruit and veg, so ensuring that we have fresh fruit and veg every day, and we ensure that we have foods that are high in fiber, we have enough protein in our diet, we cut down on saturated fats, specifically saturated, and we drink plenty of water. So those are sort of like the main sort of 5 things.
What about things like with chocolate? Because I've read somewhere about dark chocolate is good for you, and it's an antioxidant. Can you elaborate a little bit about chocolate?
Yes.
As soon as we come into the last 5 minutes of our show.
Yeah. So I think dark chocolate is actually definitely very good, and there's a lot of evidence that has shown that it's, like you mentioned, it's a good antioxidant to have, and obviously obviously we tend to not sort of advise on
chocolate donuts and stuff.
Exactly.
Sugar
Yeah,
donuts.
but a little bit of dark chocolate is definitely will go a long way.
And what about the time that we eat certain foods? Because I think there is a strategy that lots of GPs and doctors and consultants will say to eat your last meal 2 hours before you go to bed. What's your views on that?
So we say try and have your meals at
As
least as early as possible, and at least sort of give yourself a 4 to 6 hour break before you actually then go to sleep. In
order 4 to 6 hours?
Yeah, about 4 to 6 hours. So, try and sort of stop eating essentially around sort of 7 o'clock at the latest.
Okay.
Because it can affect obviously like the breakdown of fats, and then it can lead to sort of you accumulating fats, which can obviously then predispose you to certain things like cardiovascular conditions, type 2 diabetes, all the sort of like
so all those sort of things then.
Yeah.
That's interesting to know. Well, coming to the end of the show now, I just want you to elaborate a little bit about some things that you feel strongly about being passionate about how you think we can help people to lose weight. I mean, we've talked about it just now, but maybe is there anything you want to finish up on, for example?
I just want to say, obviously, if you are concerned about your weight, then do seek medical advice. There are lots of online resources available, especially our NHS website called Live Well, and patients can access that. It's a free resource, and it gives you quite a lot of depth of information as to things that you can do in order to help you live a healthy lifestyle. And a lot of that also includes sleep, because sleep is very important as well.
I'm glad you touched down on that, actually. Continue.
Yeah, so there are sort of lots of resources available that can help with sleep. There's actually an interesting app called Sleepio, which has recently been recommended by NICE, and it actually helps patients to record their sleep patterns, and then it gives you sort of healthy sort of tips as to what you can sort of put in place to actually help with your sleep.
So things like calamine tea and stuff like that, lowering your cortisol levels and stuff like that.
But it's really important to actually track exactly how you're sleeping, and that diary actually helps you to do that.
Okay.
So it's very tailored according to your own sleep patterns.
And what's your views on the smartwatch and things that tell you when you should go to sleep and how many hours of sleep you've had? Or do you think they're just fancy gimmicks? Or
they can be beneficial. I guess it's all sort of depends on how you sort of, if you like technology or if you're not very, but we do tend to advise to sort of keep away from technology before you actually go to sleep, in terms of, the blue light and, which can obviously contribute to like melatonin.
Yeah, that's right. Well, thank you very much for coming on the show today.
Thank you.
Sibel, that's really, really kind of you. And we'll be finishing off now. So thank you very much for watching. Tune in for next time. Thank you.